Hey class, we're going to do part 2 of the skeletal system, and we will go a little bit more in detail about the axial and the appendicular skeleton and a little bit of bone remodeling. All right, so just to kind of review a little bit, the skeleton can be divided into two major portions, the axial skeleton and the appendicular skeleton. Remember, the total number of bones in the skeleton is 206. We have 80 bones in the axial skeleton and 126 in the appendicular. Now, what's the definition of the axial skeleton? Consists of the bony and cartilaginous parts that support and protect the head, neck, and trunk. So that means that's the skull, that's the hyoid bone, that's the vertebral column, so cervical, thoracic, lumbar, sacrum, and the thoracic cage, 24 ribs and 1 sternum. The appendicular skeleton consists of bones of the upper and lower limbs and the bones that anchor the limbs to the axial. So that would be the pectoral girdle, clavicle and scapula, the upper limbs, the humerus, the ulna, the radius, the carpals, metacarpals, and phalanges, the pelvic girdle, which is the two hip bones, and of course the lower limbs, which is the femur, patella, tibia, fibula, tarsals, metatarsals, and phalanges. Okay. So if you look at this in orange, I would say orange, yeah, that's the axial skeleton. Okay, so the skull, the ribs, the sternum, the vertebral column, and the sacrum. 80 bones here. And then in yellow, the appendicular, so you have the upper extremity, you have the scapulas, you have the pelvis, the femur, the tibia, the fibula, and the tarsals and metatarsals, and another 126 there for a total of 206 bones. And yes, you have to know all 206. Luckily, we have a right and left, so really half of that, right? Okay, so here's this outline again for you. This was seen previously, but you can always look at this again, how we derived 80 and then 126 for a total of 206 bones right there. So let's start with the skull, which is again part of the axial skeleton. So the skull is made up of 22 bones. 8 cranial bones and 14 facial bones. There are also 3 bones in the middle ear. So right here, the malleus, the incus, and the stapes. Except for the lower jaw, which is your mandible, skull bones are connected by immovable joints called sutures. Okay, so there's no way really, you can't say, hey, move my frontal bone. You can't really move that bone, but the hyoid bone is here, and the jaw bone is really the one that you can move. The bones of the cranium you have encloses and protects the brain, provides attachments for muscles, and contains air-filled paranasal sinuses that reduce its weight and increase vocal resonance. Okay, so if your skull was one solid mass, you could have probably wouldn't be able to hold it up. The other is you wouldn't have any muscle attachments, you wouldn't have blood vessels or nerves because there's no holes to go through, right? And also it helps resonate the sound. So every time I talk, the chambers will help resonate. Otherwise, if I talk and it's just solid mass, every time it would just be like boom, 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 like kind of dancing in front of a speaker, which you back in the days you used to do, not anymore, right? You got smart. The frontal bone, it's right here, anterior part of the skull above the eyes. Features include the supraorbital foramen and the frontal sinuses right here. The parietal bones, which are up here, form the roof and the sides of the skull. Just behind the frontal bone, they join along the midline of the sagittal suture right here and meet the frontal bone along the coronal suture right here. So in lab, I want you to spend time and say, hey, identify these bones, the frontal bone, the parietal bone, these sutures. Okay. In lecture, you want to know, hey, how many bones are there? Where are they located in relationship to each other? Okay. So a perfect example or a question that I could ask is, hey, how many bones in the human body? I could say all the following are in the axial skeleton except how many bones in the skull? Which suture joins the parietal bones and the frontal bone. So these are just examples and relationships that you want to look at. Remember, lab is pure identification. You're touching, you're looking at it, you're saying, okay, what's this feature? Whereas the lecture part is more conceptual. Numbers, location, okay, function. The occipital bone, which is back here, forms the back of the skull and the base of the cranium. Features include the foramen magnum, the occipital condyle, joins the parietal bones at the lambdoidal suture, which is back here. Okay. The temporal bones, which are on the side, they form parts of the sides of the cranium. Features include the external acoustic meatus, the mandibular fossa, mastoid process, styloid process, zygomatic process, connects parietal bones at the squamous suture. The sphenoid bone is like this butterfly shaped bone, helps form the base of the cranium, sides of the skull, and portions of the orbits. Okay. Features include the sella turcica, and inside the sella turcica we have something called the pituitary gland that sits inside, so it's well protected, and the sphenoid sinuses. Now the ethmoid bone is anterior to the sphenoid bone, and its features include the cribriform plates, the crista galli or perpendicular plate, which is right in here, superior middle nasal conchae, and the ethmoidal sinus. So if somebody gets hit in the nose and they have a fractured nose, they can also damage the ethmoid bone, which is located posterior to the nose. Okay, and these cribriform plates usually have smell receptors. And during COVID, the COVID virus used to go up there, go through the nasal conchae and go up into the cribriform plate and kind of embed itself. That's why a lot of people lost their smell during that time. So here's a visual representation. You're like, okay, you gave me a whole bunch of words. Now show me where that is. Okay, no problem. So here's the skull. Here's the anterior view. You're looking straight at it from the anatomical position. Here's the frontal bone. Here's the parietal bone. Here's the temporal bone. Here's the sphenoid bone, which is purple. Here's the nasal bone. Posterior to the nasal bone, you'll find the ethmoid bone. Here's the lacrimal bone. Here's the perpendicular plate of the ethmoid bone, so you can see the relationship. Here is the vomer bone, and that makes your nasal septum. Okay. Here's the mandible that moves. A foramen is an opening, so this mental foramen allows openings for blood vessels and nerves. Here are your teeth, permanent 32 permanent teeth here. Here is the maxilla. Okay. Here is the zygomatic bone, which is your cheekbone. Okay. Here's the middle nasal concha, which is here. And then you have the inferior nasal concha. And what these conchae do, when you take a deep breath in, it helps to warm and humidify the air. Also, if you have large objects combined with the mucus, it can trap large objects so that it doesn't go inside. So there's a lot of use for these nasal conchae. Again, it humidifies the air, warms the air, and along with your mucus, it will trap foreign particles. Okay. Now, if you look at the zygomatic bone, and then as far as race is concerned, because we base race on skin color, but if you got to remember, when you pass away and your skin color, your skin, your hair, nails, everything falls out, all you're left with is a skull. So based on National Geographic findings, really there's only 3 main races in the entire world, and it's all based on this cheek structure right here. So there's the Caucasian race, which are the Aryans, the Hamites, and the Semites. There's the Mongolian race, which is Northern Mongolian, Chinese and Indo-Chinese, Japanese, Korean, Tibetan, Malayan, Polynesian, Maori, Micronesian, Eskimo, American Indian. And there's the Negroid race, which is African, Hottentots, Melanesian, Papua Negritos. They do say that there's a 4th race where the Australians, the Aborigines, the Dravidians, and the Sinhalese are there. So because they have a different cheek structure. But really, remember, race is not based on skin color. It's based on anatomical features, skull features, zygomatic features. So if I were to show you this, you're like, okay, and if I didn't label this down there, you don't know their hair, you don't know their skin color, you don't know how they speak, you don't know where they're from, but would you be able to figure out that, hey, this is an Asian skull, this is a European skull, this is an African skull, This is female, and then male, right? So here's the Asian male, here's the African male. So this is what forensics, CSI, will use to determine what they find. Now, of course, mixed races, you're going to have a combination of the two, but this is purely Asian, purely African, European. So again, going back, Caucasians, Mongoloids, and Negroid races, it's all based on the zygomatic. And if you look at the cheek structure here, you can look at the distinct different neat cheek structures, the eyebrows, the frontal bone, the mandible, right? The vomer bone, the perpendicular plate, the zygomatic bones here. Okay, males versus females. So here's females, here's males. Okay. So again, looking at this, there's some distinct differences between males and females, of course, and when it comes to cheek structure, but then also there's distinct features amongst races. Okay. Now, if you look at the frontal sinus, that's here. Now you're saying, oh, my sinuses are clogged. Well, there you go. See, these sinuses can get filled with mucus, infected with green gunk, and then you want to dry these sinuses out so you feel better. Okay. The facial skeleton, which is here, okay, contains 13 immovable bones and a movable lower jawbone. These bones form the basic shape of the face and provide attachments for muscles that move the jaw and frontal facial expressions. Bones of the facial skeleton use the maxilla from the upper jaw, the hard palate, floor of the eye orbits, insides of the nasal cavity house the upper teeth, and contain large maxillary sinus. So this is the maxilla right up in here. Okay, this is the maxilla right in here. The palatine bones are L-shaped bones located behind the maxilla and form the floor of the lateral walls of the nasal cavity and the posterior portion of the hard palate. You have zygomatic bones, which are right here, form the cheekbones and the lateral walls of the orbits. Features include the temporal process, which joins the zygomatic process to form this zygomatic arch. And a lot of times this arch can determine your race. If you go back to the three races, you're like, okay, where are the Hispanics? Where are the Indians? Well, it depends on your ancestors, where they came from, right? So there's no distinction. You're like, well, there's no distinction here, but it's all either you're Caucasian, you're Mongoloid, or you're Negroid based on your cheek structure. Okay. Lacrimal bones form part of the medial walls of the orbits, which is here. Nasal bones form the bridge of your nose. The vomer bone makes a portion of the nasal septum. Inferior nasal concha are frail, scroll-shaped bones that support mucous membranes in the nasal cavity. I showed you that on the other slide. And the mandible, which is your jawbone, supports the lower teeth and it's one of the strongest bones in the body. So it's very difficult to break. You remember, if you know who Kanye West is, he actually had to have his jaw wired shut because he broke his mandible during a severe car accident. So if you ever listen to his famous song, I think it's called Through the Wire, he's the first line of the lyrics, it says, sipping on Ensure. And the reason he's sipping on Ensure is because his jaw is wired shut. So here is a side view of the skull. Here's the frontal bone. Here's the parietal bone. Here's the occipital bone. Here's the temporal bone. Here's the mastoid process, which is, if you go behind the ear, you can feel that bump there. You don't want to push too hard because anterior to that is the styloid process, and that's thin. That can break there if you push too hard, so you want to be careful. Here's the maxilla, which is the yellow. Here's the mandible. Here. Again, here's the zygomatic bone with the temporal process, and then you have a temporal bone with the zygomatic process. All right, so that's kind of tricky, but you want to know that, hey, temporal bones have a zygomatic process, and a zygomatic bone has a temporal process. If you look at the inferior view, here's the foramen magnum. This is where your spinal cord comes out of. Here's the temporal bone, here's the occipital bone, and these occipital condyles, that's what sits on top of C1, which is your first vertebrae, cervical 1, which is known as atlas. There's the styloid process. There's that vomer bone. Here is the palatine process of the maxilla, and here is your palatine bone. So if you were to put your tongue on the roof of your mouth, you can feel this bone right here. The zygomatic bone, the frontal bone, sphenoid bone. If you were to cut this portion off, remove the brain, you would see this right here, and then you would see the ethmoid bone. The sphenoid bone, like I was telling you, is like a butterfly shaped. Your pituitary gland would sit right here, so pretend that the brain is right there, and then this little thing that dangles on there, the pituitary gland, which has a lot of hormones, important hormones, would sit right in here, and so it's well protected. Here's the temporal bone. Here is the foramen spinosum, where you have nerves and blood vessels that can go through here, and then there's that foramen magnum again, which your spinal cord goes through. Here's a side view, a side cutout to show you the relationships. Again, this is best learned in lab, where you can actually hold the skull, touch the skull, and see the 3D relationship between all the bones. It's hard to sometimes do this on a 2D model. This is why we have break this class up into lecture and lab. Now, the kid's skull, little infantile skull, is not completely developed at the time of birth. And the main thing is because it wants to go through the birth canal. If it was one solid mass, it would never make it through that birth canal. So it's mostly hyaline cartilage, so it bends and it shapes. This is why kids that are born naturally, you can see that they kind of have a cone head because they're pushed through the birth canal. What we call these, they also have these soft spots. So you ever see a baby up on top of here, you can see the heartbeat go boom, 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 boom. And these soft spots are known as fontanelles. You never want to push on there because that can cause damage. But they allow bone movement during childbirth and brain growth because the child's brain is continually growing, growing, growing. So these soft spots allow for that to occur. As cranial bones grow together, fontanelles will eventually close. So depending on the child, they can close 3, 4, 5, 6. Completely close around that time. Most of the time it's about 5 or 6. Infantile skull has a small face, prominent head, forehead, and large orbits. Nasal cavity and jaw are small, and sinuses are not completely formed yet. So if you were to look at a little baby's skull, that's what it looks like. These are those fontanelles. And then again, these fontanelles are these soft spots, but they allow the bone to grow. They can shape and make its way through the birth canal, but also the brain inside is growing at a rapid rate, so these are going to be able to expand. So when a baby falls, there is room for the baby not to get severely hurt because the fluid doesn't accumulate as much. Meaning you don't want the baby to fall, but a baby falling on its head is not as detrimental. I say this with take this as an adult though. The adult, everything's fused together. If there's internal bleeding, there is nowhere for that blood to go, and that can cause a subdural hematoma, and they might have to drill a hole to get that pressure and that fluid out. Whereas for the baby, they're a little more forgiving, so they fall and they hit their head, and it's a little bit cartilage. It gives a little bit more, but also it's pliable, so it can expand and decrease. So if there is some swelling that can take place, it's not as detrimental. Now again, anytime a baby hits its head, we definitely want to get that checked out, but I'm just trying to tell you from a clinical standpoint that we are more concerned when adults hit their head because there's no room for the skull to expand. Okay. The anterior fontanelle is here, the posterior fontanelle is here. Again, these will completely close as these bones grow. Now you've probably seen little babies with helmets, right? So here's the little baby helmet. And what they do is, if a child is left on its side one time, or if it's left on its back, because it's hyaline cartilage, they're going to mold to what they've been. So you'll see one side of the head be flattened this way, one side be flattened this way. You're like, oh yeah, I've seen babies like that. So you can see that they made it so that it would push this side in, and then this side was fine. So have a nice round head. So you can tell the difference between a C-section baby and a natural birth baby. The natural birth baby will have like kind of a cone head, and a C-section baby will have a perfect skull. But then again, if the parent, even a C-section baby, if the parent just leaves them lying in their crib on their back, they're going to get a flat skull right there. Okay, so make sure you turn and hold your baby every once in a while to prevent that. All right. Okay, let's take a little break here.